Hey everyone, welcome to another AI conversation, and I'm here today with Mr. Tom Navasero. Hi, Tom. Nice to have you on the show.
Good
Yes.
afternoon.
Yeah, so we were just talking offline. I met Tom in the Cornell group, and it was actually a good experience being able to talk to the Cornellian community about artificial intelligence. Obviously, Cornell is one of the leading institutions in the US looking at artificial intelligence. I don't know if many people know the popular uh, preprint repository, archive, is actually hosted by Cornell University. So a lot of the AI papers are actually there. And that's actually taken the place of many of the formal journals. You know, the pace of the industry is going so fast that by the time you get an actual paper posted in a proper journal, it's probably outdated already. That's why most people look at these preprint servers as the place where new things are happening. Okay. So Tom, I don't know. For the few people who don't know who you are, maybe tell us a little bit about yourself and what you're doing.
Sure. So I'm Tom. I'm an engineer, electrical and computer engineering. So AI has been part of my study, but way back in the 80s, focused on biomedical engineering. And from there, I built a few companies on the tech side. The last was on the medical. And this last 3 years is LabX, or the owner of Life. And that is a healthcare primary care network. And we are utilizing a lot of AI from patient interface all the way to diagnostic analysis. And so AI is not a disruptor. It is good medicine for healthcare, is how we look at AI. It's really good medicine. And it's not only, when you look at the segments, right? So if you look at primary patient care or interface with patients, this really takes a big load out of our limited nurses, our healthcare professionals. So the lack of resources in the interface with patients, AI has made them more efficient, thus providing more time for the nurse, to touch someone, to care for someone, right? So administrative, that's the basic AI stuff, administrative, automated systems, right? But then you go into analytics. This is where I think the power of AI comes in, right? AI is good with data because it is built from data, right? And medicine is a lot of data. You have your genome, you have your uh, clinical data throughout your years of living, right? Your vaccines, your diagnostics, your meds, everything about you is all data, unstructured and structured data. No doctor in your life will understand who you really are. Now we have the opportunity for something, call it the medical AI bot, to understand who we really are medical wise. So now they can actually predict our lives medically, right? We know what we eat, we know what we do, and the system will actually analyze and say, you know what? My prediction is you will live for a long time. Or my prediction, if you continue eating in Jollibee or McDo, is that you won't live for a long time. And basic things like that, right? It can monitor on a daily basis. It can monitor on a yearly and decade basis. So this is a wonderful gift to humanity, where we have genetics, we have excellent medicines from genetics, and now we have excellent medical data, analysis of medical data with the tools of AI. So it's really revolutionary. We are in a revolution when it comes to medicine, and AI is a big part of that, right? It has been for a long time, but the chatbot, the interest of young entrepreneurs, young engineers, young writers, and new money has really driven AI's use in medicine. All right. And so now you have so many new companies starting up. It's like a gold rush. It's
Mm-hmm.
like the sub 2000 when the internet boomed. This is the AI boom. But in the medical space, I've never seen so many medical AI startups. And each and every one has got their own story. Each and everyone's got their own solution to curing something or someone. So it's an amazing time as we speak, and I can't wait till end of 2024, where you'll see a lot more miraculous companies using AI to save lives. So this is happening now.
Yeah, I mean, this is very encouraging to hear. I've had my own share of dealings with the health sector. For example, over the pandemic period, we did a lot of work related to COVID, working with the likes of WHO, UNICEF. But then, and this is me speaking from all experience. The experience in the Philippines has been, I would say, less than ideal. Certainly, there's a lot of data. I think no one will argue, but it's all over the place. And just getting all of the data in a single repository and analyzing it is really like, we're not even talking AI yet. That would be a godsend, and that's the situation in the public health sector. Um, but then you have individual hospitals as well. They could be using better data management. So even on more like fundamental basis, there's a lot of opportunity. And then I'm
No,
hearing from you.
I yeah, I totally agree. That is an issue here.
Yeah.
So the company that we worked with, and I guided them, they need to actually focus on aggregation. So we have
Mm,
to first aggregate structured and unstructured data. Second, that platform needs to manage multiple EMRs,
yeah.
meaning different hospital management systems, different medical record platforms, because each and everyone's got their own, either a free one or a paid one or a semi-paid one. So EMRs need to be aggregated. Medical data can be now aggregated. And that's one of the key things we're doing here in the Philippines with DOH is providing them a platform where you can aggregate all that public medical data so that each and every patient, I call it the solution to precision medicine, right? Personalized medicine is now, right? We just need to implement. And I'm glad that Secretary Herbosa is putting some key people into that department to ensure that they really look into digital technology. They actually did a quick study. We were included in that discussion 3 months ago by DOH. They were doing basically a sweep on who's doing what in medical AI in the Philippines.
Yeah.
Right. And as you probably read in the newspaper, we launched the largest medical AI initiative not only in the Philippines, but globally, it's one of the largest because it's going to serve some 28 million public school children, right? And we're using that same digital platform.
Yeah.
So
Yeah, let's focus on that, because I think this is stuff that everyone needs to hear, especially people working in the medical and public health sector. So can you dive a little bit of detail? I mean, what are
sure.
some of the companies or projects you're working on, and how did you get started with this in terms of the mindset and the technology?
It all began with the Universal Healthcare Law. Republic Act 11223 opened an opportunity to really now and finally um, start primary care. Primary care, for those who understand, primary care is the first point of contact between the patient and a doctor. And then from there, the doctor finds what's wrong with you. And if there's something wrong with you, they will navigate you to secondary and then potentially tertiary care.
Yeah.
Right? The difference between secondary and tertiary is probably the number of rooms, and the abilities for operations or critical care or ICUs are more in the tertiary level. But for primary, it's the first point of contact between patient and doctor. So the Universal Healthcare Law is emphasizing its investment and its regulation on ensuring that everyone is under a primary care network. And a network is important, not just a primary care provider, but a network. A network allows one person in one barangay healthcare services to go to another barangay far, far away to also get the same healthcare services. Right now, it's very localized.
Hmm.
Your LGU, right, Maybe Calamba, is where you are actually going to have your medical services. If you go out of that circle, you don't get free medical services. So the goal here is to create a network so that now it becomes ubiquitous and totally equitable across the plane. Let me start with sharing with you what we're doing with the children. And our focus is children. I'm not saying because it's too late to save the adults, but the children are the future of the country. They are known to be the healthiest, pediatrics. They're also known not to have that many primary care needs. So the way we utilize AI in primary care is on all levels, okay? So in the beginning, registration, it goes through Ask Inday. Ask Inday, because she's the Secretary of Education, we created a chatbot that does triage for both adults and pediatrics. So Ask Inday is the first point of contact. It'll ask basic questions, minimizing the need for nurses 24/7.
Hmm.
Second, if there is something wrong with the child or the parent, it will move to a what we call triage, and the nurse is pulled in. That nurse then will utilize, and let me grab one of our devices here. So what we do here is we actually install, we call them hybrid clinics. These hybrid clinics use these devices. This is both a camera, a computer, a digital stethoscope, otoscope, with a tongue depressor for taking pictures and videos of your throat and your ear, right? So now a doctor can do a physical exam remotely with this smart device. Second, if the doctor's hearing is not that of an expert when it comes to asthma, for example, AI steps in. There's an FDA-approved AI algorithm that will pick up wheezing or asthma in the lung measurement. So we can measure the lung, the heart, the throat, the ear, and take pictures of everything. Now it can be done remotely. So this lowers our cost for healthcare, and it provides immediate healthcare. And this does not require a clinician, right? So you can put, things like the stethoscope for the ear and then for the tongue, right? And then you can have BP also, we have SpO2 and so forth. So now technology has allowed us to provide not only a FaceTime medical exam, but an actual physical exam without a clinician required. We also took that one step further. So now we have AI with our point of care devices. We now also did diagnostics. The doctor needs to know what's happening inside your body. He needs to know what your blood is all about, your urine is all about. So now we've worked with many companies across the world, from Brazil to Korea. And these companies have developed amazing point of care diagnostics where we can do a CBC. Now, a CBC is done really by microscopy, right? People get a trained eye, a med tech, and then they can count the number of red blood cells, the number of white blood cells. Even platelets can be counted, right? Very important for dengue. And now AI does that for us. So all the teacher has to do is get a prick of blood, put it on a slide, put it into this little tiny machine we call the life lens. And this life lens is a digital microscope. And it sends that image into the cloud, and AI's algorithm steps in and starts counting everything on behalf of the med tech, and very accurate. And of course, FDA approved. So now we can do CBCs remotely without having to wait a week. Imagine dengue disease, knowing platelets every 1 hour. It can be now done at the school, at the home with these devices. Second thing is X-rays. X-rays, we call it imaging diagnostics, is very big with AI. AI is used across the board when it comes to X-rays, MRI, CT scans, PET scans, and so forth. Doctors still are involved, the pathologists still involved, but AI does a lot of work for that. So you can see now we're collecting all this data from these kids, right? We know how their heart pumps, their lung breathes, how their skin is, their temperature, their diagnostics, their CBC. We know all of that. All that unstructured data is collected, and we allow AI to do predictions. This kid's going to be sick in a few more days, or this kid is catching something. We need to watch him. And that's the beauty about AI. It can aggregate all the medical data and come up with predictive analytics. And that for me, and it's low cost. It's affordable by all. So that's why we're doing it for public schools. Amazing, yeah. So that's what we're doing. And thank God PhilHealth has to pay us per child. And that's about, I think initially it was $14 last year per child per year for primary care.
1-4. That's pretty reasonable.
750 pesos, but it covers, 13 diagnostics, 23 generic drugs, and a doctor that manages him for the full year, right? So it's tight. So I think the government increased it to $35, but we are using these tools, these AI tools, to make sure that we stay within the budget. This is the beginning of what they call value-based care. And thank you, AI Medical. It's making value-based care a reality, right? So this is an exciting part of the AI in medicine, yeah.
Yeah, this is really great news to hear. And I think if you step back a bit and think about so much of medicine is really just data management. You know, you get all of this information, and yeah, also speaking for the experience of the average patient, it's actually a question of data poverty sometimes. You know, if you don't have lab work, you can't diagnose, and suddenly we have this point of care solution that does pretty much a big chunk of that lab work, and then you get it to a physician. Can we talk a little bit about that side? So, for example, just last night I was in the middle of a tweet chat. It happens every Saturday with doctors, and the big question was the usual. You know, I mean, it's the first thing you always hear: will AI replace physicians, or people get displaced from work? I hear that a lot also in the BPO sector. So, from your perspective, working in this space, how do you see kind of the shift towards, or number one, do you feel that physicians are actually threatened by this,
Not at
losing their
all. Not
jobs?
at all. I was recommending to the Maharlika Investment Corp that we need to start building more medical schools and more nursing schools,
Mm,
right? We are the caretaker of the world. We export our medical professionals, and we also need more in this country. There's a lack of. Now, what AI does though is like what Microsoft brands it, a co-pilot.
mm.
This is a co-doctor. This is someone that will assist doctors to be more efficient so they can spend more time, physical time, actually touching, talking to the patient. So definitely no. Doctors, nurses will always be there. We will need more and more. But it'll be good that these doctors are digitally trained. They need to be savvy so that they can utilize these tools to improve their diagnosis, their way of care, so that they can manage the care pathways more efficiently, thus reducing cost and giving them more time, for themselves and for their patients. So it's a big no on, is AI a threat? Totally not. It's a plus.
I find it really odd that that's always the first thing in people's minds. You know, I mean, it's kind of like, did Excel kill accounting? Probably not, but the accountants without Excel are probably the ones at risk compared to the
Yeah.
accountants who do. Yeah. So, um, talking about this particular device, can you talk a little bit about the kind of the thought process that went into its development, and did you encounter any hurdles or challenges while bringing it to market? And in now that you have it, do you also encounter challenges and hurdles getting it
Always.
implemented?
But they're not technology hurdles, right? Technology is so way ahead of the human hurdles, right?
Yeah.
Government politic hurdles are more how you say, difficult to handle than tech.
Mm-mm.
Um, I mean, we came up with one key policy in the company, and it follows WHO's guidelines in medicine. Healthcare must be affordable, accurate, and accessible. So with those three key words, we developed our solutions. So point of care testing is accessible and more affordable, and we had to make sure it's accurate, right? FDA approved, enough data that justifies the technology. So we have selected many tools out there. I mean, there's one tool where we just brought in, and it's a simple urinalysis. It's paper. It's a card that just dips into urine and can give you over 12 different parameters, reducing the cost, no clinician required. You just piss on it, and it'll tell if you're going to be a diabetic tomorrow or not, or if your kidney is doing well or not, or your maternal wellness is not doing well or not. So these self-care kits hopefully one day are practice, and it'll add to that medical database where your friendly medical bot will say, hey, you're going to live till 120 if you continue doing this, right? And that's the goal, right? So longevity and quality of life. And I hope more and more have learned from COVID that, you know, health is wealth, right? And we need to focus on that. So
You mentioned earlier briefly about EMRs, no, and how everyone has their own format. Have you had discussions around that? How can we streamline that, or is that kind of a reality most people in
it
this space have to deal
Yeah,
with?
it's like any standard. You have so many within the standard, right? And so communications, and when it comes to data, the problem with EMRs is they become legacy platforms in many hospitals. They only want to buy it and use it, and they don't want to change it because they don't know how to transfer all that medical data into a new platform. It's just too expensive.
Mhm.
So the solution there is integrating standard APIs, right? So you just have to create interfaces between the different databases to allow aggregation. So what's great here is there are platforms out there, digital healthcare platforms, that will take multiple EMR standards, allow APIs to communicate, the databases together, and thus creating, a wealth of data, real medical data, for our algorithms, right, or models to analyze and spit out, hopefully, helpful data. One of the key things I want to warn the audience here is Chat GPT, even 4.0, may pass the medical board, but should not be, okay, should not be your medical advisor, right? Remember, the data, it's all about the value and the quality, accuracy of medical data in the system. And we know that Chat GPT 4.0 searches the web.
Yeah.
Okay. And so there's good data and bad data out there. So please do not use Chat GPT for medical purposes. It is a smart thing, but it has also bad data, and bad data can kill you. Some good data is out there. So there are some healing stories out there. People find out that they had this disease because thanks to Chat GPT, they were guided. But also on the other side of the fence, you know,
You have some
garbage in,
quack
garbage out,
examples. Yeah.
garbage in, garbage out. So please do not take garbage in for healthcare. So use proper large language models specific for medical purposes. Google Health, for example, is doing very well with their new platforms. I think it's called Med LM or Med something. So a lot of new platforms coming up. Give it more time is my recommendation. It's still too early to give full trust, but mind you, it will be there. Okay, but not the Chat GPT. No, that's a
Yeah.
different AI for medical work. Yeah.
Yeah, I noticed that I keep making a point about this. In the initial adoption of ChatGPT over last year, for example, it's like people were treating it like a search engine, and that's always a risk because it's not meant to store data. It just knows how to write sentences. That's the big problem. But people think it's an all-knowing encyclopedia.
Because it
So
knows how to.
yeah, because it knows how to write, and it sounds convenient. It's actually best used with actual data. So you can use,
Yes.
you have a database or a repository of actual vetted information, and then you can connect a
and
chatbot
it's
to it.
and it's enclosed. It is captured. It is not open to the whole network. It is captured data, selected data. I mean, when I built my own little chat bot
Mm-hmm.
for tuberculosis,
Mm-hmm.
a simple experiment I did, and I created that by feeding it only data from WHO and DOH. I want to provide a localized tuberculosis chatbot so
Mm-hmm.
that parents and doctors can do instant queries, but just on TB, right? And I
Yeah.
think that's how our medical models need to work, one disease at a time, and to make sure the interactions between the diseases also occur. Remember, humanity is so complex that one symptom may be pointing to different diseases in the body,
Mm-hmm.
right? And that's how complicated it is. And that's why I really love what the Chan Zuckerberg Institute is doing, the CZI Institute, where they're actually going to develop the simulation, right? I mean, the AI of the cell,
Yeah.
right? You can now simulate specific drugs, specific instances or elements or exposomes into that cell to see what happens to the cell,
Yeah.
thus providing solutions for medicine and cure, right? So amazing stuff going on in the utilizing of AI to that basic cell unit, you know. So exciting stuff.
Yeah. You mentioned earlier it started with universal healthcare. Do you foresee any new regulations coming up, or I don't know if there are new ones, looking at not just regulating the practice, but also providing safeguards and stuff. Obviously, there's also the Data Privacy Act. So have you had to deal with any of these regulatory requirements in your work?
Totally. Yeah, I mean, universal healthcare, it was a great law, but it's not complete, right? And things change. There is a need, and you know better than me that there's a need to regulate AI,
Mm-hmm.
right? Not regulate AI to squash it, not to hold it back, but to ensure that it's used safely, and promote it, because if we don't take advantage of AI in this country, we'll be left behind. So that's why I love, my phrase when you see me on LinkedIn. I always say AI educate, right?
Yes.
AI educate. I mean, we need to educate our children now, so that they'll be versed in how to utilize all the tools that AI will create in the coming years, right? There are two bills or drafts, I would say multiple drafts when it comes to AI, right? But I did submit one, and I know your group submitted one also. Your congressman's working on one. So hopefully the speaker and the committee on tech, or I'm not sure which committee is going to actually, multiple committees will handle it,
Several, I think, yeah.
to really come out with an AI regulation of 2024. I hope it'll come out 2024. If it doesn't, it's too late. We need it yesterday, right?
Yeah.
I think they can follow a lot of the regulations from Europe, from Biden, right? There's a lot of guidelines that are being utilized now, and I think the Philippines can draft a solid, um, amendable AI regulatory bill that will safeguard and promote the use of AI, and hopefully develop the industry here, right? Provide more funding. We don't have enough VC funding or capital going into local AI development, right? The other law I did work on is the Digital Health Act.
Mm-hmm.
So the Digital Health Act is very specific to this. It includes AI. It includes a national platform so that all the hospitals can talk, all the EMRs can talk. So there's a need for that. There's a need to access all doctors on one platform, so they're not isolated, so that EMRs are owned by the patient, not by institutions, so that you can go anywhere and pull out your EMR, so you don't have to repeat specific tests or specific additional diagnostics. So these are key things. Another one in that Digital Health Act is the protection against misuse of medical information,
Mm-hmm.
right? We don't want insurance companies or employers to take bias, or to give you a higher premium insurance fee because your genomics show that you are cancer prone, or if you're going to be schizophrenic, they don't allow you to work in their company. So these are things that we have to stop. This what we call discrimination
Mm-hmm.
against medical data, so that every Filipino has the right to a fair insurance, has the right to work, regardless of their medical information. And this is an important law because already I know that many medical insurance companies are using this medical data to increase health insurance, right? And potentially also using HR. So this is a discriminatory issue that should be put into law, and we hope to put it in the Digital Health Act also.
Yeah, I think
Uh,
that's part of the double-edged blade of getting the data is also it can be used against you. So it's good to hear that that's something that you're considering. Like the more we get transparent about data, and the more predictable your medical outcome is, the more it could also be weaponized against people.
Yeah, so the best thing is to create a law to not allow weaponizing medical data, to not allow discrimination. And the key here is insurance, work, compensation, benefits should not be discriminated based on your information. In the US, they call it the GINA law, the Genomic Information Non-Discriminatory Act.
Hmm.
In the Philippines, we should not just use genomics, because not too many Filipinos have the genomic data in some cloud system, but all medical data. What drugs you drink, what drugs you take, if you're taking dialysis. I mean, even though you sign a note saying this is confidential, dude, they can tell you if you're going for a dialysis because you have to go once, twice a week, right? So,
Hmm.
and you don't want to have that data increasing your insurance fees or discriminating you at work, right?
Yeah.
And so it's really a civil right. This protection is a civil right, and if you put this regulation into place, then you're not really worried about privacy anymore, right?
Yeah.
The insurance knows everything about you. If they do anything against you, you got one up against them,
Yeah.
thanks to the law,
So it's
right?
not
So now,
Gina, baka Mina na. Medical information,
yeah,
non-discriminatory. Pretty much any medical information.
yeah, and I've always told these, even Phil Health and DOH, medical information, all these signing off of privacy, it's hard to keep. It's like an NDA. You sign it, but it never really helps,
You can't
right?
enforce it.
Or enforce it.
Mm-mm.
But a law that will stop discrimination based on your medical data, and then you criminalize it, meaning if you discriminate, if an insurance company discriminates, you fine them, you put them in jail, but that's a civil right. So civil rights should be punished heavily. And if we put that into our law, and I hope our speaker, Romualdez, puts that into law, then we don't have to really worry about this gray area of, you know, uh, medical data information leaking and who has proper access. I mean, every doctor should have access to medical data, right?
Yeah.
If they don't, they can't help. And it's not just one doctor. He's got to have a team of doctors looking at that data, right? And they're all going to use it for some medical research too, right?
Yeah, that brought to mind obviously one of the current hot buttons these days is charter change, right? And it's for me also disturbing that data doesn't really make a dent in the constitution. Constitution doesn't recognize it other than research. But what we're saying and what I'm hearing from you is the data rights are human rights that we need to manage, and it's kind of an afterthought. Parang people just see it as a natural consequence of doing business rather than the fundamental kind of fabric of business or fundamental fabric of you are pretty much your data. So your data is you,
Yes.
and we don't recognize that issue.
That should be constitutional. If we're going to be changing economics, I'd love to change that civil right and protect that civil right to our own medical data. That way, we don't have to sign off those privacy acts anymore, because if you abuse it, huli ka,
Yeah, yeah,
right?
exactly.
You can retire after you catch one insurance company screwing you on premiums.
Yeah. So wait,
Yeah.
sige. One advantage you have is since you operate in multiple geographies, there's so much we can learn, good and bad, from what's happening abroad, happening in the U.S. Can you maybe talk about maybe top 2 to 3 things that you see happening, let's say in the U.S. that we could learn from? That would be a good benchmark, because I feel that sometimes Philippines seems to be a bit too siloed, and we're all in our own little part of the world, but a lot of best practices are already out there.
Yeah, there's some good things and bad things, right? Focus on the medical industries. I won't cover too much,
Yeah.
but U.S. and I can't point to all countries in the EU, but in the U.S. it's still a fee-based um,
Model.
medical industry
Yeah.
model, right? And we are blessed that our one Republic Act 11223, the Universal Healthcare Act, has passed in the Philippines. It has not. There is no universal law in the U.S.
Oh, okay.
They are still a fee-based nation. That's why it's I think $3 trillion annually on medical spend,
Yeah.
right? And we are a fraction of that. Okay, I mean, not even a fraction, a
We're a
minuscule fraction.
tiny dot.
Yeah.
Yeah.
And what I can say though is we can learn a lot from what not to do from the U.S. Okay, they spent too much. They made healthcare unaffordable, right? They continue a fee-based service. So insurance companies have to increase their premiums, thus increasing premiums across the board for healthy and unhealthy Americans, right? They don't focus on fundamentals, right? They don't focus on nutrition. They focus on pharma. They focus on what we call sick care rather than health care. So it's really something that, the sad part is we are following in some form and fashion this
Bias
movement towards
tendency.
sick care.
Hmm.
Yeah, but the law that was passed in 2019 hopefully will put a stop to our focus on sick care, meaning we're eating bad, we're not preventing disease, and so the healthcare money is spent on sick care rather than on primary care.
Hmm.
So that's why primary care is so important. Now, another big difference I see between the US and the Philippines, and I'll talk economics, valuation of primary care facilities.
Yeah.
If you can see now what's happening in the US is the tech companies, Amazon, I'll say CVS is also tech. So CVS bought Aetna, and they bought one of the largest primary care clinics. They bought Oakwood. Oakwood is just 200 clinics, and they paid $50 million
Hmm.
per clinic, a $50 million clinic. And so you can see the amount to spend. Amazon, CVS, Walgreens, Google are spending on healthcare.
Hmm.
Apple, of course, we can imagine what they're spending on healthcare. But there's a shift. Tech companies, Data companies like Google, Facebook are now reinventing or making sure that they invest in healthcare. We don't have the big giants like them in this country, but mind you, the Amazons, the Googles, and the CVSs are changing healthcare as we speak. And I hope it'll be focused on a value-based care and a primary care focus. And this is something that we should do here. And we're glad, and I think we're blessed to have the Universal Healthcare Act. Now it's to execute it. I mean, I'll be honest with you. I've been working with PhilHealth for over 2 or 3 years now, and it hasn't moved. It's all noise,
Bit of a
right?
challenge.
The quality of primary care sucks.
Yeah.
There's not enough primary care clinics. They have not yet released funding for primary care networks. This company up here, Life Consultant Network, was one of only 2 private care networks that were approved by PhilHealth. And up to date, 7 months after the signing of the service level agreement with PhilHealth, so exciting to launch a primary care network, right? They have yet not sent out a single or spent a single penny on primary care networks going forward. And the law says front load capitation. They want our doctors paid 30% upfront before they provide care, because that's the only way you can incentivize doctors to start caring.
Yeah.
That hasn't started. That's the saddest part. There's a lot of noise. You can see Consulta everywhere in the newspaper, on LinkedIn, on Facebook. But how many children, how many adults are actually members of a primary care network? And if they are, is the quality of that service truly preventive? Is it truly of quality, accurate, right? And of course it's affordable, but is it truly accurate and quality? These are the struggles of Republic Act 11223. It's a wonderful law, but can we execute it properly?
So
So
I'm really concerned that that I don't know. I don't know if anyone's dragging their feet on this, but so what are the needles that need to move? Do we need to promote it better? Do we need to staff people? And you said incentivize doctors. Where's the bottleneck, if ever, or to?
there's a root cause. There's a root cause in government
Uh,
management or administration of government,
mm,
right? Because PhilHealth is a government private agency. Because of COA and because of the fear of the ombudsman, many leaders in government are fearful.
of
They will
doing
not,
anything. Oh my
yes,
God.
they will not take risks. And
Mm,
when one does not take risks, it delays the process, right? If you don't want to sign the check, nothing moves,
okay.
right? If you don't want to, do the checks and balances, you don't want to, check this guy or question this guy because you're afraid of, political concerns, it doesn't move,
Mm,
right? So that's the root cause. We need to change how our government leaders, especially in the executive body, deal with the ombudsman. They have to have some sort of insurance, right? They need, they take a job. If you become the Secretary of Health, you got to make decisions and tough decisions that will, save lives or kill people, right? And that's the risk. Some of them are afraid of doing anything so that they don't have either,
yeah.
right? Because of backlash. And
So
that's the problem.
so
PhilHealth,
fear
that's the
fear
problem.
of getting audited. That's really ironic. Oh man.
Yeah. And getting investigated on, pull them in the Blue Ribbon Committee, et cetera, et cetera. So this fear is the underlying, for me,
Malaise.
reason
Mm,
of delay,
yeah.
right? We complain about delay, everything from a passport to a license to projects of this matter in healthcare. Delay is caused by fear. Yeah.
Yeah.
No.
Okay. Well, government obviously will be government and should do better. Are there other avenues, like for example, purely on the private sector that could work? So I'm wondering. I've had a parallel but similar experience in education, for example. It's been forever trying to get, the parties like CHED and, DepEd, just moving on AI. There have been some moves. And then the most I've actually personally been able to get out of government is more on R&D. So departments like DOST, for example,
Yeah.
under the banner of R&D is able to fund projects, and that's how we were able to get a few things through. But that's really drop in the bucket. You really need
Yeah.
the primary agencies to step up and move this stuff, and that's ironic.
It is very sad. when the rest of the world has already embraced AI. Universities in the US and the UK have embraced AI. We went first through all these issues about all these essays being written by AI and Chat GPT, but you know what? We got through it, right? We
Mm,
passed that issue. We haven't even gone through it here yet. We haven't even enabled our kids to utilize Chat GPT to do their homework,
yeah.
and it's sad. It's for me a what we call it, a
It's backwards
cane.
thinking, basically.
Yeah,
Yeah.
it's very sad to see that, and I really like to promote the AI educate, and so I'm behind you when it comes to education. The kids need to be up to speed, and I'm talking about not just kids, but 20, 30-year-old people need to be up to speed on that, right?
Yeah. And I feel that it's also, remember we were talking about offline word star, right?
I love
And
it, Road
yeah,
Star.
back in the day, people hung on to their electric typewriters and they wouldn't accept the idea of, oh, you mean you can edit the entire document before you print it? Kind of mind-blowing thing. And I feel that we're in that kind of that stage now where it's really the proverbial straw that needs to break the camel's back once people start jumping on board. But we're being held back by all of this medieval thinking. And part of it is also like there was this case very recently of a teacher pretty much going all out on social media, lambasting her student who wrongfully maybe just copy pasted stuff from the chatbot, but never really took the time to understand what the chatbot was saying, much less edit it. And I think it was an English student, English teacher making a big deal of it. But the her tone was, we should ban these tools. And for me, I think we're looking at the wrong problem. I think the problem
Yeah,
is
send her back into a cave and give her a bath. That's where she belongs.
yeah, but more than that, the curriculum has been the same for ages. We're talking the same
Yes,
curriculum that probably Jose Rizal had back in the 19th century.
correct.
And we're using that to fend off these new innovations. Like I, for one, would probably learn better grammar if I saw a chatbot giving me better sentences. But I'm going to be crucified if I used the chatbot. And here we are with our PISA scores in the bottom of the barrel, and that's going to be our workforce in the next 10 years who can barely read and speak.
Isn't
Something's got to
that
break.
it, though? I mean, since we're at the bottom of the barrel, why not change something? It'll actually probably do better, right? I mean, anything will be better than where we are now.
Yeah,
And I really hope that, the AI Educate initiative to educate both the DepEd, the CHED, and all the other parochial and private schools, we need to up their ante
yeah,
on that. No, I totally agree with you 100%. We
yeah.
hope
I
through
mean,
health
yeah,
Yeah, we hope through healthcare and utilizing AI tools in healthcare will open the eyes of the DepEd teachers, right? And this is one thing where they'll be working with chatbots, communicating with students, for mental health, physical health, triage. We hope that the children are educated so that they are the ambassadors of health in the family unit. Imagine if we can educate 28 million children who will go home and tell their parents to stop smoking, to stop eating, to start eating well and start exercising.
mm,
And that would be revolutionary. I mean, the force of 28 million children going back to their homes and telling mom and dad to be healthy will really change this country into a very healthy society.
yeah.
Right.
I mean, we
That's
need
what
to
our
be
mission. Yeah.
talking, yeah, moving the needle in that scale, like not like
Yeah.
these small scale little things that barely do anything.
Yeah. Life is too short to do it slow, and AI has given us the tools to do it big, right? And so we can do big data, we can do big changes, but yeah, no, it's an exciting time to be young. So my job
Yeah.
is to live longer than normal.
Yeah,
So
we should all live longer. Okay. I just realized we're nearly at the hour. I mean, this thing moves very fast.
thank you.
Let's spend a few minutes before closing on where do you see 2024? Like any interesting developments coming up, and whether this is like back technical debt from whatever was going on in 2023, or new developments that have yet to land from a healthcare perspective. I mean, just let's do future trends, future scoping. What do you see?
Well, in the near future, law, right? Law for AI, law for digital health technologies, so that we can use them because there is none.
Oh,
There's no regulations to manage our new technologies in healthcare, right? Two, I want to make sure that civil right for genomic information or non-discrimination of medical information is also put into law in 2024. The sooner the better.
yeah.
That way we don't worry about these Privacy Act, BS, right? When it comes to where things are going in the medical AI space, 2024 and beyond, I pray that the majority of doctors embrace it. Right now, less than 20% embrace it. Yeah, I think you put in there was a study done in LinkedIn, and it was still less than 10% that have embraced AI. That's okay because they think AI is Chat GPT.
Yeah.
So if
There's
Chat
more than that.
GPT,
Yeah.
don't use it, right?
Mm.
But I am seeing replications of AI and X-rays, AI for medical imaging, AI for diagnostics, AI for heart analysis. That will become a standard
Mm.
in medicine in the coming years. Using AI to analyze results, using AI to make pathologists and physicians more efficient. I pray that will be a standard and there'll be enough tools out there. I also do see industry change. I see the players change in the future. We'll see more tech companies getting into health. The Amazons, the Googles, the Facebooks, or the Metas of the world become the big healthcare companies of the future.
Yeah.
As they've seen advertising data or advertising eyeballs as their biggest money earner, now the physical health of humanity will be their biggest earner. And so they will embrace all that data. And the tech companies are the best to handle all this medical data. And so they can prevent you from getting sick, but you will pay for it.
Mm.
And I
Mm.
see tech companies taking a lead in the near future in healthcare.
Yeah. Well, that
That's
those are all certainly things to look forward to, and we should have a sequel to this chat to see when these major events are happening. But other than that, I'd like to thank you, Tom, for sparing some time to share what's already everywhere else, a fast-paced world, but for some reason has yet to translate in the Philippines. And hopefully, the right people hear these messages. And yeah, and we'll have another conversation once these major developments happen. So thanks a lot for being with us.
Thanks so much, Dominic Ligo. Thanks so much.